It is top of the hour, and we will go ahead and get started. We've got a number of people joining us
Hi,
behind the
everyone.
scenes. At the end of the hour, we will be able to take questions. And so if you know you have questions, you can use the chat function in Zoom here to put your questions in. I am Dr. John Stracks. Many of you know me or know of my work. I'm a physician based here in the Chicago area and also nationally and internationally. I telehealth. Been working in the mind body space for many, many years. And I'm here today with Michelle Grimm, who's a somatic psychotherapist who works in our office at Carmendi through her home office in Durango, Colorado. And Michelle, it's so nice of you to be here today with me.
It's awesome to be here. Yeah, I'm excited to talk about boundaries and all the things mind body with you, whatever comes up.
Excellent. Good. Can you introduce yourself just a little bit so people know
Yeah.
how you
Y-
found me here?
Yeah, it's funny you just introduced me as Michelle Grimm. That's like my past
Right. That's
life.
right.
But I'm Michelle Archer now, which is
Yes.
fun.
My apologies.
It's okay. Yeah, it happens a lot because I have different names in different places, it seems, in the mind body world. So I'm a coach essentially. I'm also a PA. So I've been in medicine a long time as a PA. And then I do a lot of mind body coaching now as I got into the mind body realm a little bit more with Dr. Stracks practice and through the yoga world that I've been a part of for a long time. I'm very body based. I'm a somatic experiencing practitioner. I'm a yoga therapist, and I use those things a lot in how I offer support to people experiencing symptoms or pain in their body. And I'm also doing psychedelic assisted therapy. So I offer support in the psychedelic realm as well. That's a little bit about me.
Okay, great. So the topic today is boundaries, specifically somatic boundaries. And I thought we could get started just with a couple of definitions to provide a little bit of clarity for people who are watching. And so there are, going to see a psychotherapist these days is not at all uncommon. And so many people have had that experiences for a whole variety of reasons. The concept of somatic psychotherapy, I think, is not as common. And so you've had a lot of training in that. Actually, I've had a fair amount of training in it as well. Can you describe for people kind of what makes a somatic therapist somatic and what the difference is between that and more traditional psychotherapy as people have experienced
Sure.
it or think about it?
Yeah. So a couple points I might highlight for somatic therapy is it really does often start with the body. Like if we tune into the body, what's happening in the body, what information does that give us? What clues does that give us to what needs there are? So there's a lot of essentially like listening to the body. Like in somatic therapy, people will say things like the body has a story to tell. Let's listen. It also then lends towards recognizing that regulating or finding ways to regulate the body can be super impactful to how we experience our lives. And so sometimes we're kind of caught up in like, I need to reframe this, I need to think about this differently, while our body's having this full experience that we're not actually tending to. And so the idea here is that we actually shift a little bit. We might even set aside the story for a moment and we might notice what's happening in sensation or what we're experiencing in our bodies. Again, that offers clues as to what's coming up for us. And it also then gives us a doorway into, well, what if I work with what's happening in my body? If I can support my body's experience, I might be able to support how I'm feeling or thinking about things as well. That is how I kind of talk about body approaches to therapy. So that's how I think about body-based psychotherapy is and interestingly, we're working on slowing down, which is not where we usually start, especially at times like this when I'm giving a talk and I know people are listening, even though I can't see you. But hi, everyone. Is we end up a little fast, right? And so somatic therapy can also be about that, as we really slow things down. And if we were to talk about like main concepts, I'll often say we're here to offer space, time, and support to
Mhm.
what you're experiencing in your body so that we can get information and we can also know how we might support more and
Mhm.
shift this experience for you.
So if I came to you as a somatic psychotherapist, right, and if I'm coming to see a therapist, there's probably something in my life going on that I want to work on or talk about. And so if I came to see you, say, because I was dealing with anxiety or pain or
Mm.
had something in my life that I wanted to be different, is it the same thing? Like, do I tell you the story of what's going on?
Yeah.
in my life?
Yeah, so that's a great question. So it often will start that way, right? We're storytellers. We understand our lives through logic, through how we relate to things. And so it will often start that way that you might share with me, hey, this is what's happening for me. Oftentimes, what I'm doing is trying to notice, like, what's happening for the person right now as they're talking about it. What's happening with their facial expressions, what's happening with their body posture, their breathing. And so I might even pause someone and say, hey, is it okay if we pause for a moment? And as you're saying that, do you notice what's happening in your body?
Hmm.
And that first again builds that awareness like, oh wow, I'm already worked up because I'm giving a talk and that's why I talk fast, right? So we actually get to slow down and notice like, whoa, I have a little bit of like this energy in my heart, or I feel this little bit of butterfly in my belly. And then we might actually start to work with that. Like, what if we actually notice that you're also sitting in your chair as you're talking?
Hmm.
What if you notice the back of your body
Hmm.
as you're describing that?
Hmm.
And then oftentimes things can start to slow down and we actually come back into regulation.
Hmm.
So that's how it might start out. Again, building awareness, what's actually happening for you?
Hmm.
And then the second step is what if we offer something? Does it help support this shifting to a little bit more comfort or a
Hmm.
little bit more regulation is another way to say that. That can actually support us moving through this experience you're having
Hmm.
without getting stuck, essentially.
Because when I talk with patients, oftentimes, like there's a fair amount or some percentage of people who've said they've been through therapy, they've talked with therapists, and it hasn't helped in the way that they want to. And so if we take the story away a little bit or put it aside a little bit, you find then that sort of paying attention to our experience in the moment helps us to get insight that we wouldn't necessarily have.
Yeah, I mean, I think one, it's another way we know about our experience is by
Mhm.
what's happening in our bodies. So we build that awareness like, oh,
Mhm.
wow, I'm actually having quite a big experience right now as like for this talk, as I'm trying to set a boundary, right? Like
Yeah.
I'm actually like I feel shaky on the inside. That can help us build that awareness. And then also it's another thing we get to tend to, right? So I think sometimes the body experience we're having might actually be the fuel for kind of the behavior we have or the action we're able to take.
Mhm.
Just the same way, like, if we need to run from a lion, we need to have energy in our limbs, right? Like that's actually what kind of the impulse or the fuel behind the action we take. And I think that often plays out a lot in how we interact with the world or interact with others or even how we tend to ourselves, is we're kind of I don't really love this word, but some people will use it. We're getting a little hijacked by what's happening in our body. Like the body's leading,
Mhm.
but we're not really aware of what even the body's doing. And so if we can give some attention to it, we might be able to support the body in some way. And then that actually can shift what we feel like we have access to. For like,
Mhm.
how do I want to respond?
Right.
What do I want to say? How am I going to actually have a boundary here? Right.
Right. And then particularly important too, because a lot of the work that you and I both do ends up dealing with the intersection between psychology and physical pain. And so to be able to stop, slow down, sort of drop into our experience physically, I think that's a lot different than most people's experience with talking psychotherapy. Yes.
Yeah, totally. And I think too, we can get a little caught there, especially with pain, because we actually don't like this is uncomfortable. I don't want to feel this,
Hmm.
right? And so the more we leave our body, the less we have, again, like access to things we can shift to support ourselves.
Hmm.
And also, leaving the body is associated with certain stress states, right? Like this is actually a survival response that we kind of leave our experience.
Hmm.
And so if we leave our experience fully, sometimes it actually keeps us in a stress state, which is what we know kind of fuels pain, is that danger state. And so there's a lot there that you can work with pain, right? One, again, is getting more information, tending to yourselves, but also recognizing like this state this puts me in of kind of leaving is part of the stress state that's
Hmm.
keeping me here.
Yeah.
That can be another thing we get curious about for sure.
Yeah, thank you. That's a really good description and helps, I think, people to understand what separates these two particular different types of therapy. Like I said, the topic today is about boundaries or the main reason we're here is about boundaries. let's talk about that concept in general for a minute. I
Okay.
know that for me in particular, the whole concept of boundaries was new when I was an adult. Like if you had asked me when I was 22 years old,
Sure.
like tell me what you know about boundaries, I've been like, what?
What?
Like
Right.
like countries, like the map?
Same, same.
And so I first started learning about it actually when I started studying somatic psychotherapy. Like that was my first introduction. So that was
Uh-huh.
probably a dozen or so years ago at this
Yeah.
point. And I think the very first way I started to understand it as trying to tell the difference between what belongs to me and what belongs to other people, and then how to tell the difference between
Yeah.
and as I learned about it personally, which was quite interesting, and I started to pay attention to it with my clients, one of the clearest examples I saw about how this all relates is a patient of mine who was a teacher. And he had frequent back spasms and was trying to work on it in this mind-body way. And what we learned over time was that like he literally did not have the ability to say no. And he worked for several years with a somatic psychotherapist to understand that and figure out how to do that. But
Yeah.
essentially, like he was a teacher, and over the course of a few weeks or months, the other teachers and the staff of the school would gradually like hand him things. And so he'd start the semester and somebody would be like, hey, like I gotta go visit a sick relative. Can you teach my class? And they'd give it to him. And the softball coach would be like, this isn't working. Like, can you coach the softball team? And then the band leader would be like, hey, we need someone to go with us to the band competition. Like, do you mind? And like people would just keep him things and keep him things, and he'd pop them in their backpack. His backpack is like backpack, and just
Yeah.
get heavier and heavier and heavier. And the
Right.
only way that he knew how to give it back was to have a back spasm. And then he'd like sort of give everything back to everybody, and he'd take a couple
Yeah.
off, and then he'd start to get better, and then the process would repeat. And
Yeah.
like, and it took him a long time to understand that he had a right to keep his things his. He didn't
Yeah.
have to take what belonged to everybody else.
Right. I just want to point out it's so interesting as you share that story. You did the like backpack move, like I'm putting the backpack on, and then you did this, like, right? Um, the reason I want to point that out is like it fits with what we're talking about somatic therapy, that we often get these clues,
Mhm.
right? Like there's something like, oh, I'm just feeling the weight
Mhm.
of this.
Yeah,
And it might not be as physical, like as what you were just trying to show, like
yeah.
the backpack, but oftentimes we do have that experience that we're starting to feel more and more like weighted down or stuck. And sometimes too, then there's this impulse to be like, I don't want to wear this backpack,
Yeah,
right? Or I don't want all these things
yeah,
in my backpack.
yeah.
And that's what can be really interesting about noticing your body's experience, because our body's often showing us a
Mhm.
lot if we
Mhm.
pay attention.
Yeah.
And actually, the neuroscience of pain shows us that usually there's a lot that's showing up before pain shows up.
Mhm. Mhm. Mhm.
If we can notice it, if we
Mhm.
can notice, like, oh, I'm just like not feeling like I can move in my life. Oh, I have all these obligations that I took on that I don't actually want,
Mhm.
right? And sometimes we can get that information from how we feel in our bodies.
Right, right.
Yeah.
This is probably a little bit more than we had talked about talking about, but how do you help people sort of get a sense that that's going on when they don't have that sense up in their head?
I don't know if this is going to really fly, but I would say your body doesn't lie. It might be a little caught up in past memories. And so that we have to tease out. But your body doesn't lie. So your body, if we kind of pause usually with someone, for example, that's having trouble saying no, if I say, okay, let's actually pause because they're starting to show signs already that they're uncomfortable with all the ways they're saying yes, or like, hey, I have these obligations that I don't actually want.
Mhm.
So
Mhm.
we'll notice the discomfort. And generally, as we start to notice the discomfort, something will show up in their body where they're like, I just want to push that away, or I
Mhm.
really want to like get them out of my head, right?
Mhm.
Like these are
Mhm.
things I hear, right? If
Yeah,
we just
yeah,
slow it down.
yeah.
And so there's the no starting to build in their body. And
Right.
if we can
And
let
I'll
them,
point out too, the way that you noticed for me, right? You literally there are physical movements as you
yeah.
describe that. Like I just can't, like I need it to go away.
Yeah, yeah. But
And
you know what doesn't happen sometimes is if we don't slow down, we don't actually notice that's happening, but that's like the beginning of pain, right? Like
Mhm.
our body actually wants to do something
Yeah.
that we're stopping it from doing.
Hmm. Hmm. Hmm.
And so oftentimes if we start letting the body do what it wants,
Hmm.
we see those things start to shift. But yeah, like if you slow it down, people like they'll all say, let's just actually pause and notice what's happening. And they'll start talking to me like this. They'll do something like this, right?
Yes. Yeah.
Or it's even just the backup, right?
Hmm.
Like, oh, like I just want to get away. And if you let those things start to show up, they can start to get in touch with like, oh, my body's wanting more space right now,
Hmm.
or I want to give that back. It's not
Right.
mine, right? And so if we follow that, we can really get in touch with the boundary.
Right. And you have to touch into that and name that because right, in traditional therapy, like that, you're going to bypass that. You're going to hear the story and say, like, what are you thinking
Yeah.
or feeling? But you're not going to notice that people are leaning back in their chair or moving forward
Yeah.
or trying to make themselves big or small or the
Mhm.
rest of it. And so, sort of having access to that part of our somatic selves, it really starts to illustrate what's going on in our world.
Totally. Yeah. And it also, as we were talking about, kind of like is the fuel behind our actions and behaviors. If we can get in touch with that, and maybe I'm jumping ahead in where we'll get in talking about somatic boundaries,
Yeah.
but it does oftentimes make us feel more capable of setting boundaries because
Mhm.
now, like, I'm feeling
Yeah.
the like, I want you backed up,
Hmm.
right? And then we really feel like, oh, I'm going to do that now.
Yeah.
Right.
Yeah.
If we can
Yeah.
get in touch with it. So, yeah, it's really interesting to follow kind of what the body's wanting to do.
Hmm.
And oftentimes it does help us meet needs or come back into more feeling regulated in our bodies, more at ease in our bodies, if we actually meet our needs that our body's telling us about.
Yeah. Yeah. No, our body's so on our side and our body so sticks up for us and just have
That,
to figure out ways to honor that and let that happen.
yeah. Yeah.
All right. So you and I talked about an exercise to try of somatic boundary setting. Is it okay if we go ahead and explain that and do that for
You
everybody?
know, it just made me think of one other thing, if it's okay if I share.
Yeah.
So some of the things we talked about, like how we learned about boundaries,
Mhm.
are still coming to mind. I think could be helpful to those listening,
Mhm.
because some of what we're talking about is trusting and following the body, which I think is a really important part.
Mhm.
Other times we'll have kind of tendencies that our body's more comfortable with, like how you said you learned about boundaries as an adult.
Yeah.
Right?
Yeah. Yeah.
So, you know, and I did too. Like I thought that being boundaryless is what love was.
Right.
Right? Like in order to really love someone, you don't have boundaries.
Mhm.
And so setting boundaries actually was really uncomfortable for me.
Mhm.
So there might be some of that desire that shows up if I do it in a session with a therapist or a coach, but it would be hard to get there for
Mhm.
me
Mhm. Mhm.
because it didn't feel right. Like
Mhm.
I shouldn't be doing this.
Mhm. Mhm.
And so sometimes we actually have to practice with things. So we had talked about like separating from our patients or our clients
Mhm. Mhm. Mhm.
in some of our kind of brainstorm discussions.
Yeah.
And that's been something that I've actually had to work hard with is like, I actually need to lean back. Like, I don't know if you notice, even in talking, I'll just start getting a little
Mhm.
closer and a
Mhm.
little closer because
Mhm.
I love being in connection,
Yeah.
right? And I love that work. But sometimes for me to really recognize I'm here and I'm having a separate experience from you,
Mhm.
I actually have to sit back in my chair
Mhm.
and I have to practice that.
Yeah.
And I have to practice that with my loved ones too. Like, oh, right. I'm over here. I have a body
Yeah.
that's actually separate from the person I'm talking to. And so I want to bring that up because, you know, again, if we give enough space, time, and support, I do think that boundaries naturally show up. And
Mhm.
boundaries also can be about connection
Mhm.
too, right? They're not always about getting further, they can be about getting closer. But sometimes we have to practice with certain things to recognize, like, oh, does this feel better when I sit back?
Mhm.
It actually does feel better. And again, that's that noticing.
Yeah.
Like when I'm here, I'm getting kind of like hyped up and I'm kind of anxious if I actually pay attention. And when I sit back here, oh, I feel like I can be back in conversation and I'm more regulated again. So I just want to bring that up that sometimes we actually have to experiment and practice with different things that are kind of missing. Like I didn't know about boundaries. So I sometimes have to kind of like practice a boundary skill in my body.
Yeah. And I
What's
think, and
important.
this is a little bit more heady than it is somatic, but I know, as we're talking about, right? Like I didn't, when I first became a physician, which was 15 years ago, like this concept just wasn't there. And so, in medical school, they kind of teach you like you're responsible for how everybody does. And then if people aren't feeling well, it's uncomfortable. It's uncomfortable for me as a physician, it's uncomfortable for other physicians.
Mm,
So as I started to learn over time that people could have their own experience that didn't have to be my experience, it made me much better able to stick with people when they weren't doing well. Because
right.
even though sort of I'm there and I'm trying to help them figure it out and I'm part of it, we're still two different human beings, and I can be present for their suffering without taking it on my own. And I think a lot of physicians who don't understand that get stuck and they think like, okay, like they haven't healed it, then they've done something wrong and they start to pull away. And so I think the people who are listening, probably many of them have had that experience where a physician starts to blame them or like tell them they're doing something wrong, or if they're not getting better, becomes disinterested. And I think that's sort of poor boundary hygiene essentially amongst medical professionals, which that's a whole nother subject we could talk about. But I think being able to recognize that we don't have to carry things for other people paradoxically makes it much easier to help people carry difficult situations when they're dealing with them.
Totally. Yeah. And I mean, I think we are regulated by being around a regulated individual, right? So if you're getting pulled into someone else's dysregulation or challenge, is another way to say it, you actually lose that capacity to do that. And I think, even though maybe some of the listeners out there haven't experienced this with their physicians, like we feel this all the time in relationships, right? Of like,
Mhm.
wait a second, I'm actually feeling your struggle. What's happening with me? And one way we talk about that in somatics is like if we leave ourselves, who's home to tend to you, right? That's actually what this is about. Is like if I'm well, I can actually be with you more and support you more, right? But if I leave myself because I'm fully in your experience
Mhm.
and I don't even know what's going on here, I
Mhm.
actually can't tend to myself in a way to help me be well, so I can actually be here for you. So I just wanted to bring that up. That again, it kind of started with saying like sometimes we have to practice with these things and learn them. But I wanted to also bring in how it can apply so much to relationships because this is a thing I see so much in the people I work with.
Mhm.
There's these kind of like wanting to say yes or no to things, but there's also how we experience relationship. It can bring a lot of challenge to why like pain shows up or other chronic symptoms. And I think this is really applicable to how we relate to others for sure.
Mhm. Okay. Got it. Got it. Got it. So let's put a pin in that, and
Sure.
we have an exercise to do. And so I'm going to be the example, but everybody at home can follow along with this. Correct?
That sounds great. Yeah. Let's actually start with this. Do you have an idea of like a time you'd like to have a boundary in
Um,
a certain setting or with a certain issue?
yes. Let me think
Okay,
about
and you don't have to share it if you
it.
don't want to, but
Okay.
okay.
Yeah.
Okay, so what we're going to do is Dr. Stracks is going to do this again. You at home can do this as well. We're going to use what's in your space, but I'm going to invite you here to actually create a physical boundary around you. So, like, I have a
So
water bottle.
it's physical boundary, like, so tell me the difference between a physical boundary and say an emotional boundary or an energetic boundary. Like what do you mean by physical boundary?
Yeah, so so here's one thing I'll say about working with boundaries somatically is we're working with them through experience and through our senses. And so we are going to probably impact if this feels like an emotional boundary or kind of more of an intellectual boundary, but we're going to do it through experiencing your physical setting.
Okay.
Okay, did that answer your question?
Yeah.
Okay. So we are actually going to take physical things in your
Okay.
space. Like I have this little like salt candle holder,
Okay.
right? Whatever you have around, I'll invite you to start kind of bringing them around you.
And so people at home, like they can get up, they can sort of look
Yes.
around their space and sort of
Yes.
find things that might be good. I'm gonna grab a couple of books off the
That
shelf
sounds
here
great.
because those might help.
Okay. So as he's doing that, I'll just describe what we're going to do. And you're going to take those things and you're going to place them around you where you want them to be to create a boundary. Now, you don't need to think too much cognitively about this. I want you to just kind of go on gut. Like, I'd like to have it this far away or this close. I want my objects this close together, this far away. I want them off to the right and the left and the back, or maybe it's just to the front. So give some thought to that, and I'll give you a few minutes and you might have a comment or question, it looks
No,
like.
no, no. I had the art of healing. I have the
Oh,
principle of
nice.
science here, which is too heavy to actually lift. But okay, so help me understand sort of how I'm going about this and what I'm trying to do.
Yeah. So I want you to give some thought to how close you want them to you,
All right.
how close together you want the object. So how solid is this boundary going to be, or is it going to have more spaces between the objects you have there?
Hmm.
And then give some thought to side. Like, do I want it in the sides and the back, or is
And
it
am I
just in the
thinking,
front?
so you would ask me to think about a boundary that I wanted to set, correct?
Hmm. Yeah.
And so the objects that I have or the things around me, I'm going to use them to sort of to essentially symbolize the boundary.
Yep.
Because
Totally.
because the person I'm thinking of is not here.
Yep.
And then do you want me to start to do that? All
Yeah. Do it. Go for it.
right.
Yeah. And so for those of you at home, you might notice he's just really kind of feeling it out, right? Like, where do I want them? He might fuss with them a little bit. You might do the same. That's a strong boundary right there. I saw that book. Hmm. And so just tune in, like, where do I want this? And you might just have a sense for like, yes, I want it there. No, I don't want it there. And this doesn't need to be complex. Just feel into it. Like, where would I want this?
Is there a right and wrong way to do this?
There's no right or wrong way to do this. I was just about to say that. You got it. Yeah.
Okay, so this is interesting. Okay, so I've got
Yeah.
some things in front of me.
Okay. Okay. So as you start to settle into kind of seeing your boundary that you've created, I want you to just start to tune into you. Like, how does it feel to sit within your boundary? And you might look at your boundary and you might just sense into your body and see what you notice.
Do you want me to tell you?
Yeah. If you're willing to share. Yeah.
So the boundary that I'm thinking about, so college age kids, and so thinking about one of them and something that he's working on that he really needs to do on his own,
Yeah.
but I don't want him to do it.
Right. Right. Yeah. Yeah. And so there's some emotion arising because there's like it kind of feels conflicting.
Hmm.
And so take a look at your boundary and you might modify it, right? Because you're noticing kind of the response to it.
Hmm.
Um, and sometimes this is where imagination comes in too, of like, I've got this solid book, but I can actually still reach out and I could touch the person or I could be with them, but I actually have this space that's also mine.
Right. Because when we set boundaries, we can make them super strong or we can make them softer or transparent. So, okay, let me organize a little bit. Like once I settle in, it's a little bit more comfortable when I first, like, clearly I did not
Yeah.
boundary at all.
Yeah.
Um,
Is there some way that you know that this feels helpful? And it's okay to also say no, like, I don't actually like this. You could say that too. But is there a way this feels helpful that you notice in your body?
I'm trying to think. Like I know intellectually it's useful.
Yeah. Uh-huh. Yep.
Um, and trying to sort of if I sort of sit inside my boundary, like the emotion is still there,
Yeah. Uh-huh.
interestingly. I can feel the tendency to like want to reach across it and keep
Yeah.
myself from trying to do that or feeling like I need to
Yeah.
like trusting that he's okay.
Yeah. Yeah.
How does that?
Now I'll invite one other thing. This can change in any way you want it to,
Uh-huh.
right? You're in charge of the boundary.
Mhm.
Do you want to change the boundary right now? The physical boundary you're creating. Because also, I just want to point out for those watching, like, you see how impactful it is. Like, emotion started to arise. There's kind of this conflicting feeling, right? There's a lot it's bringing up that we get to work with.
Mhm.
Do you want to change it?
It seems to be kind of okay.
Okay.
where it is. Like everything's kind of arm length away. Like
Yeah.
nothing's right up on me,
Hmm.
and nothing's so far away that I can't sort of get it if I need to. There's a lot here. Like I got these two books, there's a phone, there's a pen, there's a lot going on.
I was gonna say that might be part of the boundary. I don't know if y'all notice what he said is I can reach them and I could change this, right? So there's something about that that feels supportive
Mm-hmm.
of like, this isn't out of reach. I'm still kind of in charge.
Right. And and I'm trying to like my sense is that like if I stay behind the boundary for a little bit, my sense is that my body starts to relax into it.
Hmm.
Just a little bit more like less of an impulse to reach across, a little bit more, say, relaxation in my shoulders, maybe,
There you go. Yeah.
or like
Mhm.
my energy kind of settles
Hmm.
a little.
Great. So just take a moment to notice that. Like there's a little bit of settling happening.
Hmm.
Shoulders, energy comes down a little.
Right.
Hmm. And so if you imagine bringing this with you when you're with your child,
Yeah.
what comes up just as you think about it?
So I was thinking actually right before you said that, even
Yeah.
that like there's more more certainty that he's okay on the other side.
Yeah. And also this feels a little edgy. This is how I describe it sometimes. Like I sensed it. Does it feel a little edgy to even say it? Like maybe he's more okay. Like I can trust him a little bit that he can.
I don't know that edgy was how I would describe it. Like again, right? It's necessary. Like he's
Yeah.
becoming an adult, like he's got to do these things on his own. And so it like there's clearly the sadness
Yeah.
there and
Huh?
like I feel it behind my eyes and like
Yeah.
in my voice.
Yeah. Hmm.
But but like I said, also sort of less of a need to just be like, no, I got to get this away, which I think when I first
Yep.
was like, this is not a good idea.
Right. Yeah. So I want to point out too, again, and sorry, we're doing some where I'm kind of describing what's happening so for people who are watching and also kind of being in this with you. But what Dr. Strax is bringing up is he's feeling a little bit more of the sadness, but there's also like an okayness here. Do you sense that okayness here too?
Yeah.
Yeah. Okay.
Yeah.
So this is what I mean by like if we stay home, we get to tend to ourselves. Like this is actually what Dr. Strax is needing is like some support. This actually feels sad
Hmm.
to let his growing son take these steps out into the world that he knows like are kind of necessary, but all this stuff shows up when he's like, I'm trying to let you do this, but I really don't want to, right? Is actually creating a little bit of a boundary, let you tend to yourself while you're still also showing up for him.
Hmm.
Yeah.
Yeah.
Mhm.
Yeah. So,
Yeah.
okay. Anything else I should do or know while the boundary's here?
I mean, I know we're in like a we're talking to a group of people, but I would recommend like a little bit of time to just tend to like
Yeah.
this is hard to have space with your child.
Yeah.
And
So
there's stuff that shows up for you that you really have the opportunity to tend to here.
And so some people at home are watching us and interested sort of in the experience you and I are having, and some people are doing it on their own and interested in that experience too. So let's just give maybe 60 seconds. It's a long time when we're on air, but just to let me settle into that, and for people who are doing it at home to let them settle into it too. Can you time us? Sure.
Yeah, I can do it for
Okay.
sure. Yeah. Okay. And as you settle into that, I just want to honor and mirror back that there was something that also felt right about this, that in your body you were like, actually,
Yeah,
this feels good to have it here. Okay.
yeah.
So we'll do that. Okay. And so we'll start to find your way out. Take your time. It's been about a minute. Hmm.
Thank you. Thank you for creating that space for me and for the people who are watching.
Yeah. Yeah. Yeah.
There's still a lot of emotion there, and then it started to settle. And then I recognized like it doesn't have to be an all or nothing boundary, right? It doesn't have to be like a wall that he can't get on
Mhm.
the side of. And I
Mhm.
felt myself wanting to like change the physical boundary to make sure that there was space
Mhm.
that like he could reach across, and trying to
Mhm.
settle my own energy onto this side of it where I need to be. A really interesting experience. Thank you.
Yeah, it is. And I think that's what's so interesting about somatic work. It overlaps sometimes with psychedelic work because it's just like it's a way different way of interacting
Right.
with our lives,
Yeah.
where it's almost like an altered state of consciousness because we're such good thinkers. We're
Yeah.
such good thinkers.
I love
But
thinking.
letting, yeah,
What
but
are
letting you feel things, right?
yeah.
It's just a different way in.
Yeah.
Hmm.
I know we've got about 10 minutes and people may have questions. And so people at home should be able to put into the chat if they have questions for us. And so if you're listening and you have questions for me, Michelle, about this, try typing that into the chat and see if you can get your questions over to us. We're happy to answer them. As they're doing that, and so, people who know me and you, Michelle, know that we do a lot of the work on physical symptoms. Just to make it a little bit more explicit, how do you find the somatic boundaries especially help to manage the physical symptoms that people come in with? That's a big question. And so
Yeah, yeah. Maybe I could narrow it down into a couple areas. One is I think of boundaries, especially somatic boundaries, as coming back to ourselves or being with ourselves.
Mhm.
And I think being with ourselves naturally implies then that we can be more in tune with our needs, which is something that's often missing when someone has pain show up. Is like we kind of missed that there was a need, and then it got louder and louder and louder until it turned into pain.
Mhm.
That's a kind of one category. Another is like as we get in touch with ourselves, we also get in touch with our life force a little bit more. Like, what is it that drives me? What am I passionate about? What brings me joy? And that is in and of itself so healing. It's like it's a totally different mind frame than what we get stuck in a little bit with pain,
Yeah.
whereas we need to be like fixing all the time, right? So that, and then there's really this like relational part that's like, hey, how do I actually be in relationship and still get my needs met? How do I say no? How do I say yes?
Mhm.
And so much relational stuff I see show up when I'm working with people with
Yeah. And I think that, I talk with people a lot about how, if you've been in this world and you understand that pain can be about emotions that we hold inside, and pain can be about self-criticism and aspects of ourselves, that we don't give as much attention to how pain surfaces around relationships and good relationships and not so good relationships and new relationships and would you mind, I know you've told us before, but your experience with IBS, can you
yes.
speak to that very
Yes.
briefly?
Yeah, I almost have like a one-liner for this now, but I had IBS. I was having really a kind of peak of symptoms, really bad level of symptoms. I was doing everything. I did all the food elimination diets. I did all the probiotic stuff. I did everything you could ever think of with my naturopathic doctor. And then I broke up with my boyfriend and it all went away. Yeah.
And so, but that's not always the answer. That was the answer
No.
in particular.
No. But it was for me. There was a lot going on in that relationship that I was trying to make it work, but there was so much of my body saying, no, this isn't right.
Yeah.
Um, and as soon as I kind of set that boundary and said, like, you're out, I'm not letting you have access to this anymore, essentially, it all went away.
All right, so our astute listeners recognize that the chat was not the right place to put the questions. The right place to put the questions was in the Q&A. And so some of
Nice.
you have done that already. And if you have more, please go ahead and do that. I'm just going to read through what some people have. There's a couple of thoughts and questions in here. And so the first one, working with an SE psychologist, somatic experiencing, and it was so illuminating because she had never realized how detached she was from her body, which is something I think that we hear a lot and notice a lot. how can I continue to enhance the awareness as I get older so that I'm in listening mode when my body messages me instead of drifting into cognition? And so a little bit about what we're talking about in terms of how we like thinking and
Mhm.
it's much harder.
Yeah. I mean, I think, this can be as easy as saying, I'm going to set aside time for this every day. There's a yoga therapist I worked with who had a practice called What's Up Today, where you'd sit down. I mean, this is a yoga practitioner. So you'd sit down on your yoga mat and you literally just kind of like touch base with you and say, what's happening in my body? What's happening in my breath? What's happening in my heart? What's happening with my spirit? And it was just a way, again, a lot of times if we just slow down,
Hmm.
you'll notice what's happening. And so that's the two pieces of that, right? One is like we're making this a formal practice where we're checking in, but also it's the slowing down. And I think that's really a big part of how people stay in contact with their bodies for sure.
Yeah. Next one here says, thank you. I love this. And wanting to take notes, but also for a friend and a lesson I'll be teaching. Do you have input in regard to knowing how to tend to myself throughout the day? As I have many people that I counsel and help through day-to-day life. How do
Mhm.
I not take on others' difficult situations and make them our own?
Mhm.
I lean
Mhm.
towards apathy and compassion fatigue as I help others.
Okay, so I resonate with this quite a bit. Great question. And, I think that people who are kind of lend towards being helpers, this is such a common thing we have to figure out. Even what I had mentioned to Dr. Stracks of how I have to lean back, I do that often, right? Because I just want to just fall right into their experience. So as far as from a somatic standpoint, it's things like that. Like I'll ask people, where do you feel most in your body? And we can do that when we're with people. Where do I feel most in my body? Oh, I can feel the back of my body against the chair, and I can feel my bum in the chair. And suddenly there's more of us with us. And oftentimes that helps that first step of like, oh, that's them, and here's me. Um, and then I do like working with imagined boundaries. Today, Dr. Strax created a physical boundary. We noticed how that impacted his experience, but imagined boundaries are really helpful too. Like I'm working with a client right now who has a force field, and he uses his force field when he's with his partner. And there's certain qualities to his force field that he's imagined where like again he can reach out, he can still see her, he can still take in what he'd like to, but he's got the capacity to let something stay outside the force field.
Mhm.
And so it almost can feel funny, but it's using our imagination to help our system essentially have what it needs to recognize that we actually can have a separateness while still being in connection. So I would say play around with that. Like I've got a guy who made it, cinder block wall, but it was only up to the level of his waist. And so he can reach over and he can still see people. It's this far from him. It's in the back, right? Like we did all the imaginings.
Yeah.
And sometimes that can be helpful too. And again, using that clue of like, I'm feeling fatigued by how much compassion I'm giving is kind of the first step. Like my body needs support. What might that support look like? It might be a hammock I get to lay in, and now the other person's not in the hammock. I mean, we could come up with anything, right?
Right. Yeah.
So that's where I would start.
Yeah, yeah. This next question is question and comment that she could feel the sensation that I was feeling. And so sort of the like I feel like I'm gonna cry and the muscles around your eyes and mouth just from watching me and sort of having that experience. And so what we're talking about, how easy it is to enter into other people's experience just by being around them. And my
Yeah.
experience with clients here at Cormindy and the work that we've done is that a lot of us have a lot of mirror neurons. So it's really easy for us to be part of other people's experience to the point that sometimes we need to put in boundaries so that we don't get consumed.
Mhm.
And she also said she started yawning a lot. What do you notice about yawning in the work?
Yeah. Yawning's so interesting in somatic work. I think the best way I can answer it is that it shows that there's some shift happening in the nervous system. We don't know what. We could get interesting, to get curious about it. Yeah, it happens a lot when things are shifting or there's some discharge happening. So we'd have to work together more to know, but we would get curious about it for sure.
Yeah.
Yeah.
So a couple more questions. It's coming up on 10 till, and so we'll
Okay.
put it down before too long. Somebody said the example that we put a pin in, which I think is we're any quick thoughts about the ways that working on our the way we relate to other people can help us with our physical symptoms?
I just see it so much. So like, yes, is, is the
Right,
person.
right.
Yes.
So let me I'll answer
Yeah.
one. So somebody had written in, right? They could
Hmm.
see me sort of have that emotional reaction, and then they're in that emotional reaction. And so certainly I think that's one of the things that happens. And
Hmm.
if we're around people who are suffering, it's hard not to suffer, especially the
Totally.
closer we are to
Hmm.
that person. And what I say to people sometimes is like, what kind of, mother or sister or father would you be if you felt totally great while this very important person to you is struggling, whether it's physically or emotionally? And so recognizing that we can be supportive without taking it on is one way
Yeah.
that we can use that knowledge to try to feel a little bit physically better, even as people around us are struggling.
Yeah, so let me put that a little bit in somatic terms because that's a little cognitive, right? As we're kind of trying to create a concept around this. But I don't know if y'all noticed when even as Dr. Stracks was having this emotional component show up of like this actually feels hard or I feel sad. He also like checking in with his boundary. He's like, no, but this feels right. There's something about that feels right too.
Yeah.
And so that part of getting to know like when support's there, really noticing the support and how there's something about it that actually felt helpful too. I think that's kind of the muscle we're trying to build, right? Because we are social animals. We're wired to try to make sure others are okay so we know we're okay. But if we completely leave ourselves, again, we might actually kind of waste away, fade, like, right? We're not actually tending to ourselves. Who's taking care of us? And so even tuning back to Dr. Strack's experiencing and saying, but are you noticing this is actually helpful for you? And him saying, yeah, this actually does. I feel like I'm softening a little bit and this feels a little better. I'll often relate this to thinking about cells and cell membranes. This is a metaphor I like for boundaries, where cell membranes let things in, let things out, keep things in, keep things out, so that the cell can function well, so that it can serve the whole human being, right? That's what we're talking about in relationship is like, I have to be functioning well to actually serve. And what do I want to let in, let out, keep in, keep out so that I'm functioning well, so
Yeah.
that I can serve in relationships. So, that's a big concept, but hopefully starts to create an image or a metaphor for how we might think about this.
Yeah, yeah. And so just a couple more questions than or more comments than questions. But somebody who like the exercise just really helped with the experience of setting a boundary and says feeling safe behind the boundary while appreciating the space between the objects, which allowed for availability. So what we're talking about, so that helps us feel comfortable enough to be there for that person. And we'll do this again to reinforce that somatic strength. And so thank you is the comment
Awesome.
there. And then this one, a little bit anxious about what was inside the boundary circle. So it used a pen as part of the boundary, but felt strongly that I felt strongly I wanted it in the protected space with me, but didn't really want my water glass in the space. So how do you work with those types of reactions with inside outside as you do this exercise? That's really good.
Yeah, I mean, you saw me kind of almost giggle a little bit like that's so I'm so curious, right? I think that's the first part is like we can start to get curious about what that if we give it space, time, and support, like what else shows up. There's clearly something there, right? Which we get to turn towards as like this is going to give me information about myself if I let myself kind of get curious with it, stay with it, slow down, right? And so I don't have an answer right now at all, but it would be something to be curious about for sure. And sometimes it's in the context of what, this brought up for you, or there was a concept that you brought in about who the boundary was with, or setting the boundary. There's so much we could get curious about there.
Yeah, and I think the curiosity is such a, when I was studying it, and you said like that's such a key component of this. And
Yeah.
so when I think about somatic psychotherapy, I frequently, like I don't have an agenda frequently and just sort of being there and seeing what happens and what bubbles up. And it's
Yeah.
really useful to sort of take that judgment out of it. And then the last question, and then we'll sign off. Are there other ways to help to cultivate that? So the awareness and the pause and the curiosity, meditation, body scans, other practices, anything else that you'd recommend to people as a way to sort of build up their ability to do this and benefit from it?
I mean, I think getting more in touch with your body is really the foundational work for this. Or maybe the other way to say it is building the muscle for checking in with your body. Like you don't have to have all the answers about your body. That's what I'm trying to be careful about. Like, oh, if I get in touch, I'll know all the answers. It's more about like, oh, I'm in a body. Oh, here I am, right? And so more about the touching base with your body regularly of like, my body's here giving me more information about what's happening with me. And the more we do that, the more we do that when we're with others, when we're in a situation where we actually want to set a boundary, where we're in a situation where we want to get closer or we want to get further away, we start to recognize that our body might be able to give us information about that.
Mhm,
There's also things like squeezing the body, feeling the boundaries of the body.
mhm,
Tapping, I think, is a great experience with boundaries. I
mhm.
tell people to do this in the shower, feel the places the water touches you. Like these are a little bit more concrete ways to feel the edges of your body that I think help too.
Right. And did I remember right that you had a yoga nidra class that you taught, sort of a little bit more formal way of teaching these kinds of skills to people, or maybe you
Yeah.
still,
I'm not teaching it currently, but Yoga Nidra is one of my favorite practices for sure in yoga.
yeah,
And it's a body scan, but it's kind of in the repetition of it of like, oh, I'm in my body, or here I am, I'm in my body. Oh, I can feel my body. Some ways I'll tell people like, this is my body belongs to me, I inhabit my body. Like we'll work on that a little bit. That's kind of a Yoga Nidra
yeah,
uh,
yeah.
inspired
And I think,
approach.
like a lot of things we do, right, there's no right or wrong way to do it. And so any of those formal, informal, that just help us to notice where our body is, helps us
Hmm.
to skills. So,
Yeah.
so
Yeah.
anyway, it's about five till, so we'll sign off. I know that you and I both have
Okay.
appointments to get to. Thank you to everybody who's been here and listening. Thank you to everybody who held space for me to have that experience. Thank you, Michelle, for leading me through that. Michelle, if people are interested in somatic psychotherapy with you, contact us through Cormendi, best way to, uh,
Yeah, for sure.
and you're happy to talk with people about all aspects of this, correct?
Definitely. Yep. I'm
Thank you
here.
so
I
much
love it.
for
Yeah.
being here and sharing your wisdom. And thank you to all who are here listening. I hope everybody has a great rest of your afternoon and a great week. And feel free to get in touch with us if you have any more questions.
Bye, everyone. Nice to be with you. Thanks, Dr. Stracks.
Thank you. Bye.